Good afternoon and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian, a licensed marriage and family therapist and a certified sexologist in full-time private practice located in Encino, California. And I'm here along with Dr. Robert Jaffe, my business partner and colleague, who is also a psychotherapist and a certified hypnotherapist. Today, we are going to be talking about addictions, trauma, codependency impacting relationships, which I will invite Dr. Robert Jaffe to continue with this discussion. Welcome, Dr. Robert Jaffe.
Thank you. Thank you.
You're very welcome.
So we started off, we've been talking about codependence for a long time.
Yes.
The reason for that is because it is an addiction that is unnamed pretty much in our society. Some people have heard the term codependence without really understanding it. Other people haven't heard what it is, but even more people suffer from it without recognizing that they are suffering from it, that there actually is something called codependence. It is a form of addiction, and we are here today to say that it is the most widespread addiction, even more so than drugs and alcohol, which, as most people are aware, is very widespread. But codependence is very widespread and has the additional component to it being unnamed. So if you can't name what's going on, it's hard to recognize when you have it, and it's hard to get any help for it.
You can't, change something when you're not aware of it.
Exactly. And so people say, well, what is psychotherapy? Psychotherapy has a lot of components to it. One of my clients actually asked me about it this morning. He asked, what actually do you think a therapist is supposed to do? And I said, there's, from my point of view, there's two main jobs of the therapist. The first is to help the person understand themselves and trust themselves so that they can live their lives more as their authentic, true, loving selves. And that gets disturbed through their life in terms of needing to conform or needing to rebel against their parents, against other people, against society, so that they lose touch with who they really are. I said, to me, that's one of the pillars. I said the other one I think of as kind of a parenting substitute. So we as therapists then become the parent to the person to let them know what a good parent looks like and how that person can then begin to parent themselves. I think those to me are the two main parts. And so in codependence, what happens is we get parented by parents who are not themselves their authentic true selves because of their parenting. And of course, their parenting got handed down to them. It's intergenerational transfer. So their parenting got handed down to them by their parents, who got handed down to them by their parents. So it isn't a matter of blame, because if it's intergenerational, where does it begin, right? And it can begin, many hundreds of years ago. And what's the point of looking back that far? And besides, we don't even know who those people were. So this isn't good therapy is not about blaming our parents. It's about understanding what our parents were able to give us, that some of which were positive, some of which wasn't positive for us.
Yeah, this is such a good, point, because when we talk about parents with my clients, they say, "Oh, I'm not here to blame my parents, or I love my parents, or I feel guilty blaming my parents, etc. And when I explain to them, this isn't about blaming parents or anything. Our parents did the best that they could.
Mm-hmm.
But some of what they give us is actually obsolete today.
Mm-hmm.
And it simply is not working.
Right, right. Also, our parents, like you said, they did the best they could. Um, I think if we know better, then we do better.
Mm-hmm.
People say, well, that's not necessarily true because I know that I should give up smoking, but I still smoke. And then I say, well, let's talk about the definition of what it is to know something. So I can know something intellectually. It doesn't mean that I know it emotionally. And I can know something emotionally. It doesn't mean that I know it intellectually.
Right.
So what I say is when we know something both intellectually and emotionally, then we can't really do anything other than that because that's what feels right to us and our brain agrees with us. So if our brain and our emotions are located in our bodies, if our brain and our body agrees with us, we do the behavior. So uh, it brings up the term of cognitive dissonance. Cognitive dissonance is simply a fancy way of saying that our brain and our emotions are at odds with each other.
Right.
That means that we can smoke, and even though intellectually we know that it's bad for us, emotionally we haven't gotten the message yet. So the therapist's job then is to educate the person intellectually if they need it. Like in the case of smoking, if some people don't have the facts about smoking, having the intellectual awareness of what smoking does to your lungs and your blood system and your body, that's important. But that alone isn't going to motivate the person. So what will motivate the person is when they start realizing emotionally that with every puff of the cigarette that they're taking poison into their body. And when you really get that emotionally, then you can't smoke because you're doing something and you are aware in your body that you're hurting yourself. It's sort of like how many people are going to actually knock their head against the wall,
Right.
or how many people are actually going to take a fist and punch themselves in the face. Uh, those are disorders as well, but for the most part, people aren't going to do that because they're aware at that moment that it's harmful. But when people are smoking, they have blocked out or they never receive the information emotionally how harmful it is. So basically, codependence is an addiction in that it focuses a person's well-being on how other people are viewing them. And and so when you focus your well-being on how other people are viewing you, you've given your power away to make decisions for yourself. And people who are codependent often find other people who are codependent to get in relationships with, and then they try to please the other person. And as long as the other person is pleased, then I can be happy.
Yes.
But if the other person isn't pleased, then I can't be happy. And then I have failed in my job to please the other person, and they have failed in their job to please me. And then they end up getting angry at the other person because they haven't done their job. Your job is to please me. I'm married to you. Your job is to take care of me in whatever ways I believe you should take care of me. Your job is, and my job is to take care of you in whatever ways I believe you need to be taken care of.
And some of that, I mean, this is so true. And some of that actually, it is fed to us by society too,
Correct.
right? I mean, when we look at, roles that are assigned to male and female in society, right?
Mm-hmm.
We automatically, when a couple gets married, we automatically, even in this modern time of society, that men are the provider and women are staying home moms,
Mm-hmm.
right?
Mm-hmm.
It is something that it's not outside the equation yet.
No,
It
no,
is
no.
not.
It's still very common,
Yeah.
although not as common as it used to be.
No, but it still is there,
Yes,
right?
yes.
Even with the new couples, there is still that subconscious, assumption that a male is to provide and for a woman to provide at home,
Mm-hmm.
right?
Mm-hmm.
And automatically when a child starts to cry, the mom is the first one who goes and pick the child up,
Right.
right? Automatically when there is time to do laundry, it's the female who grabs the basket and picks up all the clothing from here and there. And uh, and then one of my clients, the wife had to leave because she said, she works outside. She's a professional woman, but when she comes home, she has to do all the housework as well, and her husband doesn't do anything.
Mm-hmm.
And the husband claims, I've been working all day and now I'm home and I want to just relax. And then, but expectation is to have a warm dinner. Expectation includes to
Mm-hmm.
have folded clothes in the drawers, and expectation is for the house to be quiet,
Mm-hmm.
and children's, do what their homework quietly. So it is unfortunately subconsciously is there,
Mm-hmm. Right.
and that is something to need. They need to be. So so this person's wife says she ultimately left,
Mm-hmm.
and she said she's not going to do that anymore.
Mm-hmm. Yeah.
So now they're here in therapy so that the husband can understand why the life today is really 50-50,
Mm-hmm. Mm-hmm.
And it doesn't matter how much of an income the wife brings home and how much of an income the man brings home. It just happened they happen to have different types of jobs, so therefore it gives them different types of income.
Right.
But ultimately they're 50-50 life partners.
Mm-hmm. Right. So codependence then is an addiction to the other. And so last week we started talking a little bit about the genesis of codependence. How did codependence come into being? And so there are in the book that I use to talk to the listeners. I use this book by Charles Whitfield called Codependence: Healing the Human Condition. I've read a lot of books on codependence. This one is from the 1990s, but it covers it. I think it's the most thorough of all the books that I've read. And here he has a table called the Genesis of Codependence, and here he lists 18 different factors that create codependence. The first one is wounded and inadequate parents and unsupportive other environment. So, wounded and inadequate parents means that the parent doesn't know how to nurture the child emotionally. Uh, the, the parent may know some things about how to nurture the child, but what happens is the parent is unable, because they haven't learned themselves, how to be emotionally supportive to the child and acknowledge the child's feelings. And so the child's feelings then do not get attended to adequately, and the child's feelings don't get noticed, um, or if they do get noticed, they're noticed in a negative way.
Right.
So, cheer up. You have it a lot better than I had when I was your age.
Exactly. Yeah.
Those kind of messages.
So we just got the notice of commercial break coming up,
Okay.
and we would like to invite you to please join us. Call us, 951-922-3532, and we look forward to have you back with us right after this short commercial break.
See you soon.
Welcome back from our commercial break. This is Heart program at KMET 1490 AM News Radio. Dr. Mitra and Dr. Robert here. For those of you who just joined us, we are talking about codependency, addictions, trauma, impacting relationships with Dr. Robert Jaffe and myself. And I'm giving the microphone back to Dr. Robert Jaffe to tell us about the genesis of codependency.
Thank you. So, the wounded and inadequate parents and also unsupportive other environments. This is the first thing that happens to form a codependent individual. The second one is the invalidation and repression of the person's inner life, and the inner life are the emotions and the feelings that we have. So those are our internal cues. So our emotions, when we have an emotion, you can think of emotion as E/motion. E stands for energy. So it's an energy inside of us that gives rise to motion, to an activity or behavior. So whatever I'm feeling, I need to be able to say what I'm feeling so that it comes out of me, so that the other person can be affected by that. That emotion may be sadness, it may be fear, it may be happiness, it may be joyousness, it may be disappointment. So we need emotions to connect to connect with another person, to feel like we're being joined by them. And if, because our parents didn't know how to respond well to our emotions, then we learn not to respond well to our own emotions, or to know how to respond to other people's emotions. So that's the second part of the genesis of codependence. And so we don't pay attention to our emotions, or we have an emotion and we get confused by it, or we act on the emotion rather than recognizing it's an emotion, but it doesn't have to be acted on. It just has to be felt, and if we choose to, expressed. And by choosing to feel and express it, we then get a chance to look at it more openly and have other people respond to it, and that's the healthy way of relating. So the third thing that happens is it's a neglect. It is in our family of origin, our emotional needs are neglected. So what does that mean? That means if the child falls down and hurt themselves, the parent may say to the child, "It's okay. You really didn't get hurt."
Right. We hear that a lot.
Yeah, yeah. Or they may, or even worse, they may say, "Oh, well, stop crying. I can see it. You didn't even. It's no big deal. Look, it's a little cut. It's no here. Let me just put a Band-Aid on it. Now it's fine."
Oh, honey, nothing happened. See, all you have to do is just wash it out.
Yeah.
Don't worry about it. No harm done. No harm done.
Right. And people, and so people listening now to this, and they're going, "Well, what's wrong with that?" Well, what you're basically trying to say is the fact that the child got scared, or the fact that the child just had to endure pain, even if it was just a little bit of pain, doesn't have to be acknowledged.
Right.
We don't have to acknowledge that. We just have to try to minimize it and make it all better by not paying attention to it.
And if somebody experiences pain, emotional or physical, they just have to keep it to themselves, and it's therefore the child learns that not to be expressive in adulthood.
Right.
And to always, kind of suppress the feelings, the negative feelings that they experience.
Right. So what effect does the neglecting of the emotional needs have on the child? And this is the fourth thing that Dr. Whitfield talks about. He says it begins to stifle the child's expression of feelings. So there are people who still believe that when a baby cries, that you let the baby cry until it cries itself to sleep. Why is that not right? It's not right because the baby is crying for a reason. The baby isn't waking up and going, oh, I just feel like crying. The baby's waking up and maybe feeling scared, or maybe feeling wet, or maybe feeling hungry. Usually those,
maybe feel alone
or lonely.
Yeah.
Right. And the baby has no way of soothing itself. So the baby then will cry. And if the parent doesn't recognize the cry as something to be responded to, the baby will eventually stop crying and eventually learn that the crying doesn't bring them what they want. And so then they will begin to withhold the cry and they will begin to become depressed.
Right.
Yeah. And if a baby is not held and is not nurtured, the baby can become depressed to the point of death. They call them failure to thrive babies. Failure to thrive babies was written about from a study that was done about babies in a hospital who were given, who were changed and who were fed and who were kept warm enough, but who weren't held. And they noticed that the babies who weren't held and weren't talked to or gently cooed and talked to gently did start to withdraw into themselves and became depressed. Some of them died. So that's what happens. So our authentic true self then becomes stifled, and as a result of that, we begin to become depressed, and then we look for things to keep us feeling alive, and that's where addictions start coming in. The biggest addiction is addiction to another person. So if we're addicted to the other person and the other person's personality is strong, we glom on to their personality. Their energy keeps us going. And so that's part of what codependency is. If we look for a different addiction, we look for alcohol, we look for drugs, we look for sex, we look for gambling. Those kind of things temporarily dull the addiction within us, and then it makes us feel a little better and a little more alive for a short period of time. The next part of the genesis of codependence is the beginning to construct our codependent self, which means that when we are not getting our emotional needs met, and we look for somebody else to take care of those emotional needs, we determine that it's not our responsibility and we can't do it. We believe that we can't do it, so we look for somebody else to do it. And if this particular person, if I'm heterosexual and I'm a man and I find a woman and she smiles at me and she tells me how handsome I am, that gives me a lift up, and now I start to become dependent on her in order to make me feel better. And so that's what happens as we begin to construct our codependent self. The next thing that happens in the genesis of codependence is we develop an increasing tolerance of a high tolerance, a high tolerance and numbness to emotional pain. So why do we become tolerant to emotional pain? Because our emotional pain doesn't get soothed. So when somebody hurts our feelings, we say to ourselves, it didn't really hurt. But the truth is, it did hurt. And what happens to the hurt feelings is they get lodged in our bodies and in our subconscious minds, and it makes us feel worse about ourselves. And we become more and more depressed. We become more and more anxious, and then we need more and more of the nurturing, or what we believe is nurturing, from the other person, or we need more and more of the high that we get from other addictions.
So basically what I'm hearing is that, we look to external factors to make us feel comfortable and happy.
we look to external factors because we were, when we were little, dependent on external factors,
Right.
and those external factors were failing us, and so we're now trying to get the external factors that we didn't get when we were younger met, and we don't
Such as
recognize,
love.
such as, well, love is the biggest one,
Yes.
the
Right.
biggest one. And it's possible for our parents to feel loving toward us, but still not know how to express the love in a healthy way. So my parents did love me, and I felt loved, and that was really a positive thing that I got from them. But they also had their own issues where they didn't know how to express the love, and so they gave me a lot of things. Money bought a lot of things. They gave me a Super Continental, a Schwinn 15-speed bicycle when I was 12 years old. They gave me a electric train set, which was very expensive. My mom sacrificed, didn't get a dress that she wanted, and bought me the trains when I was 5 years old. They got me a brand new car with air conditioning when I was 17 years old. They put a down payment on my house. They did a lot of really good things for me and spent a lot of money. I got myself into financial difficulty with my credit cards. They bailed me out. They did a lot of things for me, and so I had a lot of confusion between money and love, because to me money was love, and I still struggle with that. I tend to overdo it with my kids. I tend to give them big presents because that was expressed to me. However, I've learned that I try to give them emotional things as well as that, and I try to catch myself and not overdo it. But it's difficult.
Yeah, because that's what you have learned to
That's
do.
what I've learned.
Right.
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 So it wasn't a bad thing that they were doing, but because I didn't get the kind of emotional sustenance that I really needed, and I didn't get the emotional reflection of my feelings, because they didn't know how to do it. I grew up with my own addictions.
Right.
Yeah. Um, so we have. Also, there's usually a family secret,
Right.
within families. In my family, the family secret was that my mom was depressed and was suicidal, and that was never talked about. But I did witness my mom attempting suicide.
Oh my God.
Yeah,
I
I
didn't know
did
that.
witness her. Yeah, I saw her stick her head in an oven. I heard her threaten to overdo pills and would lock herself in her room for a long time, and I didn't know if she was alive or dead. And it was very terrifying, and nobody ever talked about it. It was sort of known in the family that my mom had problems, but it was never discussed and it wasn't open. So that was my family secret. But in most families, there's a family secret, and oftentimes addiction is part of the family secret. My parents did not have an addiction that was visible. However, my mom had an addiction to cleanliness and was an obsessive house cleaner.
That reminds me of my mother too,
Mm-hmm.
that she used to stop eating for a few days,
Mm-hmm.
and then she would just hide herself in the room, and
Mm-hmm.
and then we wouldn't know when these things were going to come back to normal.
Yeah.
And that also was never talked about.
Mm-hmm.
Yeah.
Right. Right. So this is all part of the construction of a codependent person. Um, the next thing is uh, the inability to grieve a loss to completion. So the losses are overlooked because the emotions aren't being talked about or expressed. So uh, one example, an obvious example for me in my own childhood, my mother and father got me this wonderful 15-speed Super Continental bicycle, and I immediately drove it to the store, and left it outside of the store and walked in to get a couple of Superman comic books, which I loved, and came out 5 minutes later and my bike was gone.
Oh my God.
And of course I was very upset, and my parents said, "Oh, well, that's too bad," and they went out and they bought me another bike. They didn't buy me the 15 speed, they bought me a 10 speed. But I didn't have a chance to really go through a grieving process and learn anything about what happened, about what, that I wasn't careful, and that I didn't realize at that point in my life that people would steal things, you know. And so I didn't get a chance to grieve that. And my parents did that a lot, where they would rescue me with money, and I never got a chance to learn the lessons that I needed to learn. I was talking a minute ago about overspending on my credit cards. My parents would pay it off for me. So it became something that I didn't know that I had to live within my means, and it took me a long time to learn that. It's a long time to learn that.
30 seconds.
So, these are what we're talking about. Are these some of the things? And as you're listening, audience, I want you to ask yourself: is any of what we're talking about, can you relate to? Because if you do relate to it, you may be struggling with some codependency, and if you do, there is treatment for it. And you don't even have to go to a therapist, although going to a therapist is a great idea. You can begin to heal yourself by becoming more aware. We will be back in a few moments. I just got a notice from our that we need to take our commercial break, and we will see you in a few moments.
Welcome back from the commercial break. Dr. Mitra and Dr. Robert here talking about codependency, addictions, trauma impacting relationships. And we have been talking about the genesis of codependence, which Dr. Robert Jaffe has gone over some of the criteria for that. And there are 18 of them. And then we are going to be presenting to you some of the remaining of them based on the time that's left for us. And thank you for listening to us.
Yes. So basically, what we're trying to do is let you know that if any of what we're talking about rings a bell for you, then you can begin to become curious about whether or not you are struggling with an addiction, and if that addiction is codependence, because it all begins with awareness. We're actually considering writing a book on denial. Right. Denial is a very, very powerful part of every human being. Most of us live in denial of many things. And denial in and of itself is simply that you don't focus on something that is real. And so most of us live in denial of our own death. On a day-to-day basis, we don't think about our own death, and we sort of don't even believe that it's going to happen. We're in denial of it. We know in our mind that it's going to happen. It's not like we're stupid and we think we're going to live forever. We know that at one point we're going to die, but emotionally we don't feel it and we don't recognize it. And part of us actually does feel like our life is going to go on forever. So denial is not like necessarily a bad thing, because if we were thinking about our death all the time, it might not be such a pleasant life, and we wouldn't be able to maybe have some energy to focus on other things. But when it comes to things that are harmful to us, such as addictions, of which codependence is a major addiction, staying in denial just perpetuates it.
Right.
And so what we're doing in this program is we're trying to help you recognize whether you are in a codependent relationship, whether you do struggle with codependence. And if you do, then you can begin to educate yourself. The book that I'm talking about is one of many. There's a lot of books written on codependency. Melody Beattie wrote a great book on the codependency. Came out a long time ago, called Codependent No More. And this book here that I'm reading, Codependence: Healing the Human Condition, by Charles Whitfield, is a pretty thick book and talks a lot about spirituality and about how codependence affects people with their belief systems and interferes with their ability to be their loving, authentic, true selves. Right now, we're talking about the genesis of codependence. We've gone through a number of them, and we just ended up with the inability to grieve a loss to completion. So what happens then if you are raised by parents who have been emotionally wounded themselves and aren't able to give you, or weren't able to give you, the kind of emotional nurturing and emotional sustenance that every child is entitled to, but we didn't get it because of the fact that they didn't have it to give, then that is a loss.
Right.
That is a loss in and of itself. If you think of your parents and you think that they're wonderful and that they did great, that's wonderful, and that may be true, that they were wonderful and did great. What I have learned is that there's no human being alive who's perfect, and so there are going to be gaps depending upon who you were born to or who raised you. Perhaps you were born and your natural parents didn't raise you, but whoever raised you, they were human beings and they had flaws. What you were commenting on, which I think is a really important point, is that people don't want to see the flaws in their caregivers because of guilt.
Yes.
And maybe you can comment on that a little bit more.
Sure. I mean, when I talk about, when I talk to my clients, and then, as part of psychotherapy that I do, which is basically, it's a deep therapy format. Sometimes, I don't want to call it psychoanalysis, but, it's not short of that.
Mm-hmm.
So many of what I see in sessions are sort of habits, sort of subconscious beliefs, perceptions, attitudes that plays itself in a real lifetime, right now. And then when we trace them back to see how the beliefs was shaped, how the perceptions were shaped, where the attitude is coming from, which ultimately they all combine, show themselves in the behavior of the client, which is the behavior includes also the conversation. So when we trace them back, we see that they picked up the initial version of what they do today, sometime during their childhood, without even being aware of that the pattern that they started to shape, it initiated during their childhood. Mm-hmm. And usually that initiation is somehow connected with how they interacted with their caregiver, which caregiver can be parents or somebody who provided parenting to the child. And then as a result of that interaction, the child, excuse me, the child is able to make meanings about himself or herself, this is a very interesting, part of psychotherapy, because we say, oh yeah, probably, for example, if I was a lovable person, I would have received that bike that my aunt gave to the other cousin, for example.
Mm-hmm. Right.
There was a bike, one of my clients told me there was a bike that he really loved and it belongs to his cousin, right? So he told his mother, and his mother, said that, oh, well, that bike belongs to the cousin. And then one time the cousin told, this child that, the bike was given away because he didn't want it, and the aunt knew that my clients wanted the bike, and his mother knew that he was interested in the bike. Both the mom and the aunt knew that the bike was going to be given away, and it wasn't given to him. So as a result, he believed that he wasn't worthy of receiving even an old bike. Right? So that later on translated to him as though, he's not worthy of receiving anything brand new. He's not worthy of getting anything that he's interested in. He can have interest, but he doesn't get them.
Right.
He doesn't pursue to get something for himself. But he does point out, oh, I love this, or this is interesting, or I want to make these travels. So
and how does this translate into feeling guilty about talking about one's caregivers?
Right. So when we bring up the issue that this is a pattern that he initiated for himself as a result of that incident, and that's one of many, of course, right? And then the minute we say that, should his mom and the aunt would have acted differently, he probably wouldn't have given themselves that depth of meaning about himself. And that's where he becomes jumpy and says, you know what, my mom did the best that she could. My mom loved me. My mom gave me everything I wanted, and stop talking about my mom, so they don't realize that, or he's not at the place yet to understand that his mom, may not even had a role in that bike being given away, because to begin with, the bike didn't belong to mom, right? But the fact that she didn't advocate for him, right, may have initiated the situation, the belief for my client. But client, just because of the codependency that he has towards his mother and not towards his wife, it's hard for him to accept that could have been something that he caused him to believe the way he believes about himself today. And he doesn't absolutely want to look at his relationship in other areas of life with his mother or his father. And he just has these amazing, exceptional assumptions that his parents were the greatest. There was never any fighting at home ever. Siblings were greatest, and he never had any problem anywhere within his family.
I see.
Which his wife, definitely suggests otherwise. And evidence of what they say also suggests otherwise.
Yeah.
So that's the guilt that I'm talking about.
Right. Yeah, because people confuse love with loyalty.
With loyalty, yes.
And if I love this person, and I'd say most people do love their parents.
Right.
And I think most parents do love their children.
Absolutely.
But that doesn't mean that there aren't other feelings as well.
Yes.
Our mothers are the ones who are in control of our lives for the first several years of our lives. And so we may love them, but we may also rebel against the control. Our mothers, our mothers take the rap for a lot of things. And like I said, therapy is not about bashing our parents. It's about learning the things that our parents did that served us, and being willing to open ourselves to the things that didn't serve us, and cause us to feel certain feelings that we are now struggling with later in life. And if we can't examine it, if we don't recognize that those feelings are still inside of us and still affecting us, then those feelings control us. And so the goal really is to have more control over ourselves. And that means looking at the truth wherever the truth leads us.
Yes.
Yes.
And without feeling guilty. Without feeling shame.
Well, eventually to the place where you don't have to feel guilty and shameful.
Right.
But usually shame and guilt come up as when we're starting that, and then the therapist has to help the person to detoxify it so that the person isn't so ashamed that they can talk about it.
Yes, and you demonstrated that very well today, talking about your mom's suicidal attitude. right?
Yeah.
Whether that was real or that was a pretend, it doesn't
Hmm.
matter. The
Hmm.
point is that that impacted you profoundly,
Exactly.
right?
Exactly.
And you truthfully are able to talk about it.
Well,
You
I've had
know,
a lot of therapy.
yes, well, yes, and
Yeah.
I myself, I talked about my mom's suicidal attitude.
Hmm.
So, but there is no guilt and shame about it. It is what it is. These are things that happen, and then we make meaning about ourselves as a result of what we witness.
Right. So we just got a few more minutes. I'm going to mention one other thing about the genesis of codependence, and that is if you have compulsive behaviors, um, in order, if you have compulsive behaviors, the compulsive behaviors, which can also be addictions, right? But it doesn't have to be a horrible addiction. Like a compulsive behavior could be to washing your hands 20 times a day, right? The purpose of compulsive behaviors is to it is to block pain, block emotional pain, and give us a sense of control over our lives. And so anything that you compulsively doing, whether it's codependence, meaning that you're compulsively seeking your partner's approval, compulsively trying to please your partner, uh, or any other kind of addiction where you're compulsively drinking alcohol, compulsively smoking marijuana, compulsively anything, even compulsively watching television. The purpose of that is to shield yourself from emotional pain and get a sense of control and order over your life. The purposes of that are not a bad thing, right? We don't want to feel emotional pain. We do want to have more control over our life. However, usually the compulsive behaviors themselves um, create problems in our life. And so we go back to the genesis that we mentioned before about grieving a loss to completion. Emotional pain are things that we learned or that stories that we made up about what things mean, as you were talking before. We make up stories about what things mean. Whether they actually meant that or not, who's to say? But these are stories that we live with, and we believe those stories, and those stories are painful.
Right.
And any kind of pain that we're feeling needs to be grieved.
Exactly.
There are stages of grief. Elizabeth Kubler-Ross was one of the great teachers of grief and the processes that people go through. But if you can't grieve the loss to completion, the goal of grief is to get to a place of emotional acceptance where the pain is not there anymore,
So
or the
let's
pain is very, very small.
so let's talk about this next week,
We will talk about it next
right?
week. We're just
Yes.
about out of time. We really want to thank you for spending your time with us. And next week we're going to have another 2 hours, 1 hour on sexuality, sexual relationships, another hour on codependence, and addictions and trauma. And until next week,
All you need is love.
all you need is love. Thank you for joining us.
Bye bye.
The preceding was a paid program. Views and claims expressed are those of the program producer and are not endorsed by